Let's talk about swim bladder disease. Your Betta's swim bladder is the organ which allows him to control his buoyancy. Instead of constantly swimming to stay in place, the swim bladder does the work instead, helping your Betta save energy and swim easier. It is located behind all the other organs, so if any of them swell it can affect your Betta. Swim bladder disease or SBD is the first problem encountered by mostly new Betta breeder, or even experienced as well. SBD can affect almost any fish at any time. Swim bladder disease isn't actually a disease. It's a term used to describe any ailment, whether it's illness, damage or situation that causes your fish's swim bladder to stop working properly. So when treating swim bladder disease, you're actually trying to treat symptoms of something else. In Betta, new breeder always encounter this problem during raising the fry. It's not 100% avoidable, but we can reduce it due to experience every batch of fry that we raised. This fry may be around 2 weeks old. They look healthy, but if you notice there are fry that only stays in the bottom, it's the sign of overfeeding. Some breeders call it belly sliders. If you catch these symptoms in early stage, just reduce the amount of feeding and lower the tank water level. Higher temperature plays a big role in raising Betta fry. I raise my fry in 30 to 32 degrees Celsius, feed 2 times a day, morning and afternoon with baby brine shrimp. When feeding baby brine shrimp, be careful with the unhatched eggs and empty shells. Please try to separate it as you can. It's the main cause of SBD on fry in my experience. Fry cannot digest unhatched eggs and shells if they accidentally eat it. This is the fries with the swim bladder fail to develop. If you notice that this is happening only after feeding, you still have a 50-50 chance to fix it, but if your fry is over a month old and display like this all the time, and maybe have a curved spine already, it will be permanent. Experts call it chronic SBD. This is where the culling become helpful. This fry with SBD is curable. You can tell that this is due of overfeeding or injury. But how to cure it? You have to be sure of the cause. Sometimes it goes away by itself. This is an adult Betta with permanent or chronic SBD. It can live a long life, but it's up to you if you can stand to watch them like that or end their suffering earlier in life. In the vast majority of cases, swim bladder disease in Betta fry is caused by overfeeding. Fry are particularly gutty and they will never stop eating, even when they're full. This often makes them constipated, which can have an effect on their swim bladder development. I have less to none SBD symptoms when I'm using egg yolk as fry food, but lower survival rate. The most higher rate of SBD I've encountered in my earlier breeding project is when I feed grindle worm, younger than 2 months old fry. All I can advise on my own experience, feed only baby brine shrimp from first food up to 30 days old fry. Don't worry about the BBS size. If you are concerned that fry is not able to eat them as first food, you are wrong. By the way, moina is still the best if available. You can feed any microworms as well, but I have very bad experience with worms, so I'm not a fan anymore. Also, infusoria is already available in the breeding tank if you put Indian almond leaves during spawning. So don't worry too much about the fry to die of hunger. SBD and Betta fry are easy to avoid if you just control the feeding. The more excited are you to see them grow, the more you are overfeeding without noticing. My simple advice is, give your fry high protein food, and a stable temperature. Give them enough space to grow, and a clean water as a key for rapid growth. Add some snails to eat uneaten food. It helps a lot. If your fry do like this all the time, there is not much you can do. You have to charge it to experience for now. Any expert breeders also experience this stage. So don't worry, we all learn every day. For adult Betta, Swim bladder disease is a range of different causes including shock, injury, infection, constipation and overfeeding. The symptoms include floating at the top or bottom of the tank, unable to stay in one spot without swimming, lopsided swimming, a distended back or bloated belly, loss of appetite, and lethargy. If you think constipation is causing your Betta's swim bladder disease, then you should fast him for at least 3 days. If you think it's due to infection, then you're going to need to use the appropriate medication. And lastly, if you think it's due to stress or injury, there's nothing you can do except be patient. You can also try an Epsom bath if your Betta is suffering from constipation-related swim bladder disease. Some of the ways to prevent swim bladder disease in Bettas is to make sure you're not overfeeding them, keeping the tank water clean, and helping them avoid injuries. Swim bladder disease isn't normally fatal when it's due to constipation, but it can be in other cases. And lastly, swim bladder disease isn't contagious, but if it's related to water quality issues, then there's a chance other fish will get it as well. It's better to prevent than to cure. So good husbandry is still the #1 prevention. So I hope my video give you some idea about this Betta breeder #1 enemy, swim bladder disease. Until next time, lovely people, stay safe.